Hello ladies and gentlemen, welcome to my channel. Today I'm gonna talk about the difference when using injections, using the needles and cannula. The needles and cannula are quite different. They have different pros and cons. The needle is the only way to penetrate to the bone surface, but it cannot do that. However, the needles has a little bit disadvantageous because it had the risk of getting the infection, which is everybody quite afraid getting blindness with clients. I know that. But somehow it is super good that this is the only way to get it to the bone. Some parts when doing injections, you are unavoidable to the bone. For cannula, I a little bit imagine to form a thin film, a very average layers, no matter on the superficial side or the deep layers, but it will be the average fanning. Compared to the cannula, needles will be like a point, a very deep point on that, which is not be layers. Before we dive into the different locations when doing the injections, I want to recommend you the size, how I daily life use for the needles and cannula. For needles, I highly recommend you use a 27 gauges. And for cannula, I really recommend that you use a 23. Why 27 for needles and 23 for cannulas? For needles, because when you are using a size bigger than that, it's quite easy to cause bruising and bleeding. But for the size which is lower than that, it's quite easily that you cannot aspirate accurately to make sure no blood flow get into your needles. So I think it's a little bit hard to know that you can got infection or not. And for cannula, there's some kind of the same reasons. If the size is bigger than that, it's more easy to get pain, more easy to get bruised. However, the size is lower than that. For 25, even if the cannula is as thin as a needle, so it will cause the infarction or penetration into the vessels, and it's quite risky to do that. So right now we can dive into the first part to do the injection, which is the chin. I'm going to start from the very downward part. The chin is inevitably the answer is needle. Because when we're doing the chin injection, you want to do the protrusion, you want to do the elongation, you want to do like a V shape. You need to put on the bone surface, which you can also call it the periosteum. Your needle didn't penetrate onto the bone surface. It will cause the fluids that flow on the mentalis. And after the procedures, when clients have the facial movement, when they smile, when they're biting, the mentalis is moving, you will feel a very weird foreign sensation. Then it will cause a lot of complaints about that. The second location that just slightly full upward to the nasolabial folds. For nasolabial folds, the needles and cannula are friends. They need to work together. They have different kinds of characters. The needle is a pretty good job to do the penetration onto the maxilla bone surface and can do the deep layers supplement. But for the skin surface, that is a superficial layer, which is more suitable for the cannula to do that. I will definitely use the insertion points beside the lips and do the oblique angles that upward to nasolabial fold skin surface and do the superficial layer supplement. And for the third part, when you talk about the nose augmentation, we can just separate it into the top, called a bridge, and we'll call it a frown and call it a septus. The answer is definitely cannula. I don't say that the use of needles is wrong. Lots of my friends, lots of my masters, they just use a needle to do the augmentation, different kind of shape of the nose. I don't say it's wrong. I didn't disagree about that. But actually for beginners, I don't think it's quite good for you. There's lots of connecting vessels between the eyes, lots of vascularization, and the news that you heard about the blindness is mostly caused by the nose injections by the needles. So for your getting started, please just use a cannula only. The same reason is for the fourth locations we're talking about the forehead. We also recommend you use a cannula only. The needles when doing the forehead, there are lots of vascularizations on that, superior trochlear vessels, the orbital vessels, and lots of connecting vessels that's between the eyebrows, which causes really quite risky when you're doing needle injections and don't have the proper aspirations technique of that. The cannula, when the size is bigger than 23, which is the larger it is, more safer that you can put the filler into it to do the forehead augmentation. So let's done with the middle part of the face. Then let's get to a little bit lateral side. This is the first one. The fifth one, we'll call it the tear trough. The tear trough, the definitely answer will be cannula. There's a lot of controversy and lots of discussion in our doctors group that some people are support of the needle use, and some people are the fans or the cannula use. For me, I tried a lot of methods. We're really afraid that after procedures, there are two post-op complications that most often cause you nightmares. The first one is tendon effect, and the second one is a numbness on the skin. We can feel that these two kind of complications result from the uneven injections when you put the fillers onto the teardrop. So to prevent the uneven, the quite reasonable way is to use a cannula, because the cannula can use really diverse to put the layers very average from A to B. But it is a little bit hard for needle to do that. Needle is a deep part. It's a point by point. I can figure out how to put it evenly from A to B and the whole surface of that. So I don't think that for beginners it's quite easy to use a needle to do it. More lateral side, I think it's the most lateral side on the face. The upper part is temple and the downward part is cheek. For the temple, beginner, the strong answer is needle. However, you need to use a little bit longer needles because the temporal bone is a little bit far from the skin. When you pull a filler just right from the skin and vertically into the temporal bone surface, I recommend you use 3/4 inches needles rather than just a half inches of needles. I don't say that there's no characteristics about the cannula. Some part, if there has a local depression of the temples, is pretty good to use a cannula to do the supplement. But you need to be really careful because when you use a cannula to do the temple, really easily to get uneven layers on the skin and cause a lumpness of that. However, in contrast, when you do the cheek supplement, the only answer is cannula. We know that when doing a cheek supplementation, the really famous are Sculptra or the hyaluronic acids or those kinds of PLA, PDLA, or some kinds of that. Those are kinds of the mixtures you need to put some setting to do it as a fluid. It's really hard. You use a needle and evenly to disperse all the fluid inside the cheek. So it is quite more easily you use the cannula to put those kind of fluid or fillers, no matter in the superficial part or in the deeper layer part, and it can cause an even result after the cheek relaxation. Actually, there's still one left. I barely forgot to tell you, which is the lip. The lip is a very complicated one. When you do the lips, you need to both use a cannula and needles. So there's no definite answer that we should use a needle or a cannula. Lips is pretty hard. Perhaps we'll talk it later in the future, or I will build an online course to specialize how to do it. Okay, we will finally get to the final part. This is a summary. 27 for needles, 23 for cannula, and different parts. Some parts, when you're getting to the bone surface, you need to use needles. If you want to have even layers, no matter you're in superficial or deep or somewhat the average plan, I recommend you use a cannula. Some parts you need to work together. They are still friends. Okay, this is the comparison between the needles and cannula. See you in the next videos.